Good afternoon, everybody. Thank you for joining us. We'll begin shortly. We're just letting people in from the wait room. In the meantime, if you would like to join our mailing list and receive news every couple of weeks about upcoming webinars and big cities health news, our QR code on the screen will take you to the webpage to sign up. We'll begin shortly. If you're just coming in, just wanted to let you know we'll start shortly. We're just letting people in out of the wait room, and yeah, we'll probably begin in just a couple minutes. All right, well, I think I've noticed that the numbers are kind of trickling down. So time to go ahead and get started. Thank you for joining us today. And we're excited to have you join us for the second in our Cities, the Future of Health webinar series. Just wanted a couple of quick housekeeping notes before we begin. If you think of a question that you would like to ask of any of our speakers, feel free to use the Q&A button at the bottom of the screen to go ahead and submit your questions at any point during the webinar. If you would please include your affiliation when you're asking the question, just so we can kind of have a sense of where your question is coming from. I'm also going to provide a link in a moment to our urban health agenda, which Chrissy will be talking about in a moment. So I'm going to hand the floor over to Chrissy Giuliano, who's the Executive Director of Big Cities Health Coalition.
Thanks so much, Elizabeth. And thanks everyone for joining us today for the second of our 3 currently scheduled webinars in our series, Cities, the Future of Health. We're excited to discuss both our vision for the future of public health with you, and to also share real-world experiences from our member cities and counties. We'll make the slides and the recording available after the webinar. So again, I'm Chrissy Giuliano, Executive Director of the Big Cities Health Coalition. Both of our guest speakers today hail from Multnomah County Health Department, one of our member departments. They serve the city of Portland, Oregon, and its surroundings. Charlene McGee is a program manager for the Racial and Ethnic Approaches to Community Health, or REACH program in Multnomah County. And Mikayla Hill is a nutrition promotion program specialist in the same program. So let me start off our discussion today by telling you just a little bit about the Big Cities Health Coalition and our vision for the future of public health. So BCHC was started more than 20 years ago to convene leaders of the country's largest metropolitan health departments, which you can see on the slide, on the premise that there is something unique about urban health and about being a big city health commissioner. We've grown to 35 members over the years who together serve about 20% of the nation's population. Our work together still focuses on the common goals of sharing best practices, strategizing around complex urban health challenges, and advocating for urban health health equity, and the public health field as a whole. The purpose of this webinar series is to introduce or reintroduce our urban health agenda and show what its core ideas look like in practice. We'll discuss a few key concepts today, but if you'd like to learn more, visit the website. The image on the screen shows you where you can find the document, and it's just now in the chat, or you can go ahead and scan the QR code. So our urban health agenda rests on the idea that protecting and promoting the public's health requires more than healthcare and what we traditionally think of as health. To truly achieve healthy, safe, resilient communities, we need things like full employment, livable wages, and earned sick leave, safe, affordable housing in neighborhoods that have access to healthy food and public transportation, and safe, appropriate K-12 education, parks, and green spaces. Our comprehensive cross-sector approach works only if we also dismantle structural barriers and systems that are built on generations of racism. Inequity, as so many people I'm sure on the webinar today know, is driven by many isms, including racism and classism. And these really contribute to systemic oppression in the form of laws, practices, and other norms that lead to negative outcomes. For example, owning a home is one of the best ways to build wealth in this country, but people of color have traditionally been shut out by policies such as redlining, which excluded Black people from home ownership and thus cut off decades of wealth building among Black families in particular. Economic opportunities and a quality education are also out of reach for too many people, which is perpetuated by fundamental barriers that widen wealth and health gaps. In our vision, all government agencies and relevant community-based organizations work together to protect and promote health and safety. Public health departments can, and often should, sit at the center of decision-making processes about community health. However, while health departments play an important role in protecting and promoting the health of their communities, no single entity alone can improve the health of the population. To be successful, these efforts require collaboration across all local government agencies and with elected and appointed officials and community-based leaders. How this all comes together sets the stage for today's speakers. We'll focus on collaboration with community-based organizations. We'll see how the health of communities can become even stronger when health departments don't just fund local organizations, but develop goals and practices in a truly collaborative way. So before we go to our guest speakers, we're going to put up a couple polls for the audience to answer. Note these are anonymous, so you should answer them, as honest as you like, but we're really just trying to get some information from folks who are on the webinar. So I think the first poll, there it is, about your organization engaging in a formal partnership with a community-based organization. So if you could answer that yes or no. And then if you answer yes, you're going to get 2 follow-up questions about initiating a partnership and some of the challenges you ran into. So we'll, I think, give a quick minute, and my colleague Walker will move us on once we have a critical mass of answers. So thank you all for answering the polls, and question 2 and 3 popped up, so feel free to answer those. Thank you all for sharing that insight about your collective experience. What I will do now, once we close the poll, is turn things over to our guest speakers who spearhead a truly innovative program to promote nutritional health and anti-racism in their community. They've faced their own successes and challenges, which they're now going to tell you about. So with that, I should know who's going to talk first, but I don't. So I'm going to turn it over to whomever is going first. Thank you again for being here with us.
Thank you, Chrissy. Greetings, everyone. My name is Charlene McGee, and I have the privilege of serving as Multnomah County's Reach Program Manager. I'm joined here today by our colleague, Ms. Mikayla Hill, who serves as our Nutrition and Health Promotion Specialist. Through this presentation, we will share our journey to build strategic collaborations between county government, local and regional food economy influencers, policy and decision makers, while operating at the nexus of a vibrant, healthy community environment that seeks to support nutrition, social cohesion, and economic mobility to build the capacity and promote economic development in under-resourced and underserved communities, with an emphasis on our Black and African immigrant farmers and food entrepreneurs. Additionally, we hope to inspire and encourage, despite challenges and barriers, to remain hopeful that policy systems and environmental change can occur to reduce diet-related diseases and health disparities. Lastly, we hope that by providing examples of the way in which we have collaborated with farmers to support community-supported agriculture and institutional food purchasing, that we have been able to promote community health, nutrition education, and support our entrepreneurs in our community. Next slide, please. So this is our agenda for our time today. We hope that through this work, we can highlight and share our partners, because as it was stated, this truly has been a collaborative process. We'll highlight the different programs and locations that we've done work in partnership with farmers, which have included our CSA. We have also worked in partnership with our juvenile detention center, and then close out with several different programs in which we again have partnered with food entrepreneurs and farmers. Next slide, please. So Multnomah County REACH program, we are funded by the Center for Disease Control and Prevention. We work to empower and uplift our Black and African immigrants community in Multnomah County by ensuring that their voices are heard. We do so by authentic community engagement, leveraging community wisdom to make policy systems and environmental change that seeks to offer solutions to health disparities and systemic barriers. Next slide, please. So this slide represents our three core strategies, as well as three cross-cutting themes. The REACH program, in partnership with our Chief Coalition, work alongside multi-sectoral partners to implement these three primary strategies and cross-cutting themes that collectively work to aim to reduce chronic disease disparities within our Black and African immigrant and refugee communities. We lead policy systems and environmental change strategies that addresses the social determinants of health and promote health outcomes across the life course, from the cradle to the grave. Next slide. So we're moving through to show the connection between nutrition-related diseases and chronic disease. Nutrition is the primary factor in the health of the leading causes of death in the United States. The highest rates of nutrition-related chronic disease are found among our Black, Indigenous, and other people of color. While these leading causes of death exist in Multnomah County, we know that these are also national trends that are mirrored, which also shows the chronic disease burden that we experience in our county. And I think it's just also important to note that despite the disparities that we know we encounter as a community, we know that our community brings forth abundance of strength and resiliency despite these disparities. This slide, as you can see, shows the leading cause of death in Multnomah County, along with their correlated leading exposures, social determinants of health, behavior, and health, and upstream policy approaches and primary prevention strategy. Recognizing that nutritionally inadequate diet intake is a leading contributor to the development of chronic disease, such as heart disease or diabetes. The upstream approach is to enhance access to healthy food across different settings, including public institutions like Multnomah County, who frequently serve BIPOC and low-income communities that experience significant disparities in access to healthy food, culturally appropriate meals, and burden of chronic disease.
So I'm going to go on. Thank you, Charlene, for introducing us. So the connection between diet and chronic disease, moving into our why. We know that nutrition is a primary factor in half of the leading causes of death in the United States. The highest rates of nutrition-related chronic diseases are found among Black, Indigenous, and other people of color, or BIPOC. And these national trends are mirrored locally in chronic disease burden experienced by Multnomah County's Black and African communities. The REACH program's nutrition strategy area focuses on advancing access to nutritious food among Black and African immigrant refugee communities. We work to address some of the most common food access barriers and affordability concerns within our community. We also strive to advance food policy and systems change to influence the institutions and settings that shape the way we eat and our long-term health outcomes. And at the center of our nutrition strategy area is equity. We see our work as part of a broader effort to foster a more equitable and sustainable food system that advances our region's climate goals and supports economic development opportunities for BIPOC growers and producers. Our presentation today focuses on how we can promote access to healthy, affordable, and culturally appropriate foods within Multnomah County as a public institution. We see the policy and pragmatic recommendations we share with you as both a chronic disease prevention and climate resilience strategy. I'll start by drawing the connection between food purchasing, community health, and climate resilience before sharing some of the REACH program's policy systems and environmental change strategies and recommendations, as well as other possible program opportunities that address nutrition security for Multnomah County's diverse communities. So how we do it. At the center of our nutrition strategy area is food equity. We see our work as a part of a broader effort to foster a more equitable and sustainable food system. By partnering with organizations like EcoTrust, Mudbone Grown, Black Food Sovereignty Coalition, Yasuke Farms, Quasha Farms, Play Grow Learn, and Arise and Shine, we support economic development opportunities for BIPOC growers and producers and capacity building of experienced and aspiring food system leaders of color locally. So we're going to talk about our community-supported agriculture program. Booker T. Whatley was born in 1915 in Anniston, Alabama. He always knew his passion was in agriculture. He created simple guidelines that he called the Whatley Diversified Plan for Small Farms. He believed that a small farm should have a guaranteed market with a clientele membership club, later known as a community-supported agriculture. And that's how the CSA model was born. For the community-supported agriculture in particular, we partner with Black farmers to mediate some of the food injustices in Multnomah County. We do this by partnering with various Black-led or Black-serving community-based organizations to refer their most vulnerable Black and African-American clients to participate in our fully subsidized community-supported agriculture program, or CSA. This initiative provides fresh local vegetables and produce for 10 or more weeks to the participants and their families in the Multnomah County area. It aims to address some of the most common food access barriers and affordability concerns, as well as provide an educational opportunity for participants through online and in-person cooking demonstrations, weekly newsletters, and recipe cards. It is our hope to provide necessary support to encourage participants to make healthier food choices. So now we're going to talk about our partnership with Donald D. Long Juvenile Detention Home. Multnomah County REACH has partnered with Donald D. Long Juvenile Detention Home, or JDH, as anchor institution in this work. Donald D. Long is Multnomah County's Department of Community Justice facility that houses detained youth ages 12 to 17 across Multnomah County, Washington, and Clackamas counties. In 2018, 730 youth were admitted to Donald D. Long with an average stay of 14 days. We know that juvenile justice involvement is linked with poorer health outcomes later in life, largely due to correlated social determinants such as poverty, unstable housing, and employment, and lower educational attainment. Detention and incarceration also directly impact health. Positive health outcomes require natural and built environments that facilitate healthy nutrition, physical activity, and other behaviors where people live, work, study, play, and pray. Environment takes on additional impact in a detention facility setting, where individual choice is more constrained. To this end, REACH has partnered with Donald D. Long to cultivate an environment that fosters healthy behaviors for its residents during and beyond justice system involvement. So their scope of food operation. Donald D. Long's food operation includes institutional food service for youth in custody, serving up to 84 youth each day. Additionally, the Courtyard Cafe serves the complex 300 county and state employees and court visitors, on average 120 people a day prior to COVID-19 related restrictions. The complex also houses a catering service utilized by county staff for meeting and events with a yearly sales of $75,000 to $100,000. Combined, these operations serve approximately 234 meals each day, representing the potential reach of food service guidelines among detained youth and government employees. Donald D. Long is also an ideal setting to promote healthy nutrition standards and food procurement because youth in custody fall under the National School Lunch Program, which meets the USDA's recommended nutrient standards, stressing whole grains, fruits, and vegetables. Donald D. Long makes most meals from scratch to avoid aspects of prepared foods like high sodium. The center highly values providing a healthy food environment, especially since many of its residents have experienced food insecurity and because its food operations include enterprises that offer food service training to youth while serving employees and the public throughout Multnomah County. Partnering with Donald D. Long represented the REACH program with an opportunity to advance broader food systems change. Together, along with Mudbone Grown, a local Black-owned farm and food business enterprise, we began building capacity with Donald D. Long to procure healthier food and improve nutrition for youth in custody. This was an opportunity to explore what could be an emerging Black-owned farm partnering with a government institution. The goals of the Food Justice Collaborative are to, one, enhance the existing juvenile detention center nutrition program, two, enhance local food procurement capacity through economic and workforce development opportunities for BIPOC farmers, and three, provide more culturally specific meal options for resident youth. Improving the nutrition of justice involved youth through local partnerships for fresh food sourcing. A pilot nutrition program was launched in 2019 through a partnership between the Multnomah County Health Department, Donald D. Long Juvenile Justice Center, and Mudbone Grown in Portland, Oregon. This program sources locally grown produce to improve the nutrition quality of meals served to the youth in residence. This is a creative partnership laid the foundation for improving institutional food service guidelines and healthy nutrition standards for other county institutions. In addition to the pilot program, we also began some ongoing efforts to support the goals of the REACH and Dell partnership. Some of these include literature reviews to support evidence-based nutritional guidelines, environmental scan conducted by Dell to identify areas of opportunity, food and health behavior survey among youth, and an annual menu review. Now we're going to move into our institutional food procurement. Procurement or food purchasing is one lever of institutional power through which Multnomah County can have an immediate and direct impact on chronic disease disparities while simultaneously promoting community resilience and driving broader climate goals. Through our food procurement policies and contracting practices, we determines what kind of food is available to employees and community members, whether that food is nutritious, culturally relevant, and health promoting, or whether it increases the risk of chronic diseases like diabetes or cardiovascular disease. Our procurement policies determine whether food purchasing builds wealth in local communities or whether it maximizes profits for corporations that exploit land and people and extract resources from our local economy. And they also determine whether food is grown in regenerative agriculture systems that support our ecosystems, health, and climate stability, or whether it perpetuates practices such as large monocrop and concentrated animal feeding operations that threaten our future. As it is often said, a budget is a statement of values, but so is a menu. Through our food purchasing power, Multnomah County can send a signal to food service companies, vendors, peer jurisdictions, and businesses about what kind of food system we want to build, as well as what kind of food system truly serves our community's health. Towards the end, we propose that through key policy systems and environmental changes, Multnomah County adopts progressive food procurement legislation that takes into account climate, health, and a broader environmental sustainability goals. Building on the strong foundation set forth by organizations such as the Center for Good Food Purchasing, we believe that it is possible and necessary for county action to prioritize and sensitize and put resources behind more just practices in food systems. So we recommended 4 key policy system and environmental changes strategies. 1, adopt a comprehensive value-based food procurement policy in Multnomah County. 2, enhance existing county nutrition standards with updated nutrition, sustainability, and equity guidance. 3, implement a greener by default pilot program. And 4, strengthen the local food system by making long-term investments in BIPOC growers and producers and removing historic barriers to food production. I'm going to elaborate on each of these strategies as well as a few additional opportunities before sharing what might take in terms for the next steps to move forward. So here's a list of public institutions that have adopted the Good Food Purchasing Program. As we look to implement the GFPP program in Multnomah County, there are a wealth of sample policies and implementation resources to guide us. I'll note that one of the most recent adopters of the Good Food Purchasing Standards, the City of Boston, went a step further beyond the 5 articulated values to include a 6th value of racial equity. I would like to see this value included in the Multnomah County's policy, and I'll share a few ideas around what that might look like later on. I don't know. In addition to adopting the Good Food Purchasing Program in Multnomah County, we recommend establishing nutrition standards that will inform county food and beverage related procurement and expand healthy, sustainable food and beverage options for our employees and the people we serve. We have drafted a set of nutrition standards that we are setting in specific and that incorporate explicit guidelines related to sustainability and equity in addition to nutrition. As a summary of these guidelines, it will increase consumption of fruits and vegetables, whole grains, minimize the use of processed foods, added sugars, sodium, and detrimental dietary fats, and recommend the use of healthy cooking techniques and promote consumption of portion sizes that align with caloric needs. In terms of sustainability, the standards aim to prioritize organic and sustainable products as well as plant-related foods, including protein and dairy alternatives, purchase meat and poultry raised without routine use of antibiotics and/or growth hormones, and reduce waste by promoting family-style service, eliminating single use of plastics, and encouraging the use of durable, reusable servingware. There we go. So the major components of healthy food and beverage policy have to do with contracting. We are proposing setting a 5% contracting priority for BIPOC growers and producers in the first year of the policy. This percentage will incrementally increase as the county simultaneously supports capacity building and land access and infrastructure development among emerging BIPOC growers and producers interested in supporting food purchasing in public institutions. So our there we go. Okay. So strategy 3, in addition to establishing nutrition standards with sustainability and equity guidelines, we are looking to implement what we call a greener by default policy. What this policy means is that plant-forward options will be provided as the default option, while giving diners a choice to opt into meat or dairy. This policy draws from the idea in behavioral psychology that people tend to go along with the status quo or default option, which in this case of food purchasing can have tremendous implications. From a public health perspective, we know that there is a relationship between healthy eating and climate-friendly diet. Eating more fresh fruits, vegetables, and less processed foods helps support healthy bodies, while at the same time mitigates the climate impacts associated with food production. Implementing a greener by default policy across county food service venues can help Multnomah County achieve its sustainability goals, reduce food costs and waste, and improve the health of our employees and communities we serve. Depending on the setting, a greener by default policy might look like offering a 2-to-1 ratio of plant to animal-based options. A recent study found that when 1/4 of the options are plant-based in a given food environment, 12% of people chose the vegetarian option. But when 3/4 of the options are plant-based, nearly 50% of people chose the vegetarian option. School and correctional settings where individuals have limited food choice might consider implementing a greener eating day. or a green eating day, where a majority plant-forward options are offered. Finally, the REACH program is advocating for county leadership to strengthen our local food system by making long-term investments in BIPOC growers and producers and removing historic barriers to food production. REACH's partnership with Mudbone Grown and Donald E. Long Detention Center Home has highlighted some of the key lessons learned and barriers to overcome with respect to procuring local food from BIPOC growers and producers. Participants in this project emphasize the need for leadership, support, and investment in food systems change. This includes supporting BIPOC farmers through lowering barriers to land access, providing infrastructure development and capacity building, and setting contracting priorities at the county level that favor minority and women-owned businesses. We know that the REACH program's priority population not only faces significant chronic disease disparities, but also experiences disproportionate impacts of our global climate crisis, whether that's through housing with insufficient insulation or heating and cooling capacity, neighborhoods with limited access to the benefits of trees and parks, food insecurity, and lack of access to quality, affordable, and culturally responsive healthcare. As advocates for Multnomah County's Black and African residents, the REACH program is seeking to advance comprehensive values-based solutions that recognize the major role public institutions play in both climate resilience and health promotions. Our efforts include adopting a comprehensive value-based food procurement policy, establishing healthy nutrition standards with explicit sustainability guidelines, making low-carbon foods the default option across county settings, and investing in local food systems and extending support towards BIPOC growers and producers. So the REACH program is advocating for county leadership to strengthen our local food system by making long-term investments to our BIPOC growers and producers. So based on these recommendations, we are proposing the following policy and programmatic approaches to county leadership. First, 5% of food service contracts will be prioritized for BIPOC growers and producers. In this way, the county can open pathways for minority and women-owned businesses. Second, we encourage county leadership to uplift community partners and CBOs or community-based organizations who are actively producing fresh, healthy, and culturally relevant fruits, vegetables, and grains for their neighbors. Finally, we hope to connect aspiring farmers and growers to productive land through the County Land Sustainability Project, which evaluates the potential of county-owned and leased land for food production. So now we're going to talk about our food access during tough times, during COVID-19. During times of crisis, before I move into our recommendations that build on the food systems work we've done with community partners, I wanted to center our conversation on some of the lessons learned and opportunities created through the COVID-19 pandemic. We know that COVID-19 exacerbated food and nutrition insecurity, especially for BIPOC communities. Households with children and Black households experienced statistically significant increases in food insecurity during 2020. During a crisis such as a pandemic, equitable access to any food is prioritized. However, as the food crisis abates and emergency programs such as the expansion of SNAP benefits are discontinued, it remains important to continue focusing on expansion and innovation of current and new policies and programs that will provide consistent and equitable availability, access, affordability, and utilization of nutritious food. It's COVID today and something else tomorrow, and we have to be prepared and proactive about promoting nutrition security in the face of crisis. So some additional opportunities that we envisioned within the REACH team, which would be provide healthy, satisfying, ready-to-eat meals on site for Multnomah County staff working at the Gladys McCoy building, recognizing that access to healthy food is a social determinant of health and that employees form part of the communities we serve. The pilot project aims to make healthy food more available and affordable in county settings while improving nutrition-related health outcomes among our staff. We also want to offer low-barrier nutrition counseling. Counseling is recommended for adults with lipid disorders and other risk factors for cardiovascular and diet-related chronic diseases. Counseling interventions help individuals acquire the skills, motivation, and support they need to shift their eating and food preparation habits. Counseling advice includes self-monitoring, overcoming barriers to selecting healthy foods, goal setting, shopping and food preparation, and social support. We also would like to implement our workplace lactation support program. Program includes providing a breastfeeding employee time and location where they can privately, comfortably, and safely express milk during the workday. Policy and program components include written policies to support breastfeeding, chest feeding employees, offering flexible scheduling and options for returning to work, such as teleworking, part-time work, and extended maternity leave, and teaching employees about breast and chest feeding and providing professional lactation management services and support. So now we're going to talk about some of our other nutrition education programs that we have led throughout the REACH program. So Feed the Mass is a 501c3 nonprofit organization that has been operating in Portland since 2016, founded on the belief that everyone deserves access to reliable, high-quality nutrition. Feed the Mass is proud to deliver multiple sustainable solutions to combat food insecurity in the Portland metro area. Their education program offers accessible digital education and workshops to the Portland community, putting the power of meeting their wellness and nutrition needs directly into their own hands. REACH has partnered with Feed the Mass to bring 8 live cooking demonstrations to the community, highlighting easy, delicious, and nutritious recipes. We are also partnering with Feed the Mass and the Blazers Boys and Girls Club for youth cooking classes. Together, we are helping to remove barriers to access resources and education. So our diabetes prevention program. The National Diabetes Prevention Program is a partnership of public and private organizations working to prevent or delay type 2 diabetes. Many people have had success reversing their prediabetes conditions by taking a diabetes prevention program class. You'll learn how to make small changes to your diet, increase your physical activity, and lower your stress to help prevent type 2 diabetes. Multnomah County is also working with community partners to host culturally specific classes. The Diabetes Prevention Program partnered with Yasuke Farms, which is a Black woman-owned farmer who provided 50 shares for a 10-week CSA subsidized by Multnomah County REACH team. So Play, Grow, Learn is a community-based organization with a dedication to provide healthy opportunities for sheltered and underserved youth in the community to play, grow, learn. Initially aimed to support homeless youth with the extended mission to serve all disenfranchised youth and families. We partnered with Play, Grow, Learn to bring the Food as Medicine Everyday series to their families. The National University of Natural Medicine established the Food as Medicine Institute, whose mission is to provide nutrition education for individuals, families, and communities in order to nourish healthy relationships with whole foods to prevent and reduce chronic illness. Since 2011, Food as Medicine Institute has been offering workshops led by naturopathic physicians and nutritionists that focus on nutrition education and simple hands-on cooking techniques to prepare nutrient-rich whole food meals. The program is referred to as Food as Medicine Every Day. Each week during the 12-week series, a nutrition topic is covered and participants cook and share a meal together. The original implementation of FAME curriculum began in 2010 with the Ending Childhood Obesity Project, a community-based nutrition education and cooking program offered in low-income areas in Portland, Oregon. The nutrition curriculum covered during the 12-week FAME series includes introduction to nutrients, food label reading, benefits of breakfast, how to build a healthy plate, healthy digestion, habits for health, such as mindful breathing, movement, sleep, and hydration, balancing blood sugar, exploring sweeteners, grocery shopping guide, healthy school lunches and snacks, and healthy substitutions on the go. The series promotes gradual and sustainable behavior change based on the nutrition information and discovering tools to be successful with lunch choices. And I'm going to share a little snippet of the video that Play, Grow, Learn put together about the program. And let me know if you guys can hear that.
Hey, Mikayla, it worked for a minute and then it got really quiet.
Okay, well, I'll move on, and then if we have time at the end, I'll share more. Okay. Oh, no. Go to next. Okay. Okay. So now we're going to talk about our crops program and the history of farming in Oregon. So there are only 3 Black-owned farm producers in Multnomah County. We need to discuss the history of how Black people were denied land grants, which led to the current disparity between white and Black farmers and land access. The Oregon Donation Land Act of 1850 codified the rights of white male citizens and their wife to claim of 640 acres of public land granted to them by future states' provisional government in 1843. Blacks were excluded by virtue of being neither white nor citizens, according to the U.S. Supreme Court Dred Scott decision of 1857. Blacks could not be a citizen and furthermore had no rights and no access to the courts. When you look at land, that's how people build generational wealth. So when some of the white farmers can say that I'm 5th generation farmer, I'm a 6th generation farmer, that farm goes passed down from family member to family member. And here in Oregon, you do not nearly hear that at all from Black farmers. And so even though our families have farming experience, they do not have access to big plots of land and it was not passed down to us. And that's the reality for many young beginning Black farmers here. To address that reality, we would like to see a system put in place to ensure Oregon's agricultural lands are not sold to industrial or out-of-state interests, but instead put into the hands of states' Black and other small-scale farmers. Okay, there we go. So we wanted to just start, sorry about that. So crops, I'll explain a little bit more about that. So our community reaps our produce and shares is a Multnomah County initiative that promotes culturally specific farming business development, healthy eating, and community building. Crops is managed in partnership with Mudbone Grown and has specific focus on Black and African immigrant farmers. The farm is currently being developed with plans for a barn, access road, greenhouse, wash pack station, fruit tree orchard, and more. The main phase of construction is anticipated to be completed in mid-2023 with work already underway. And I'm going to show a video. I hope, oh, go back. There we go. Hopefully it plays.
Yeah, sorry, Mikayla, I don't think the audio is coming through. It's
Okay.
not something.
Maybe if I try.
We can go ahead and share it when we send out the slides and the
We can
recording.
share the link, yeah.
Okay.
Yeah.
Okay,
Yeah.
that works. Yeah, no worries. Okay, so crops was started as a temporary use for surplus county land over a decade ago. The idea was to grow food for families in need. County employee farmer Jerry Hunter led the effort to create the farm, clearing 3 acres of land choked with invasive blackberry bushes and transforming the site into a lush farm. Over the following 10 years, Jerry created a safe and healing environment where people of all ages and backgrounds volunteered, learned, and shared skills, built community, and grew fresh, organically grown food for the community. The program ended, led by Multnomah County Reach Program, and FRP was developed and launched to secure farmers to lease the 3 acres of land for community-based farming. So that concludes our presentation. So now time for questions.
Great. Thank you so much, Charlene and Mikayla. I think just kind of making an executive decision here that we were going to show the results of the poll, but I think we have enough really good questions for you that I think probably best to just jump right into the Q&A. And if we have time at the end, maybe we can show the poll results. I'm going to kind of approach them in order. The first two questions that came up during the session are kind of related, so I'm just going to ask them together. Jessica was asking how the program is funded, and then you got a more specific question from Nicole at Chicago Department of Public Health, who was wondering if you're receiving a CDC grant that ends this year or next year, and if you've identified future funding sources to be able to continue your programming. In general, how are you looking at long-term sustainability of these collaborations?
Thank you for the questions. I actually started typing a response and I was like, let me just wait. So yes, we are in year 5 of our five-year funding, which is set to end September 2023 of this year. We are awaiting the release for the next round of funding to apply for that. So as typical with, grants, we do have a sustainability plan, although we're hoping to be recipients again in the future. Part of that effort, what we're looking at definitely includes county general funds and other funds we're able to secure through other local public health efforts. Additionally, some other things around sustainability that we have been doing also includes looking at other like health system partners and other individuals who potentially can come in to help to support. We actually had a great meeting yesterday with one of our local coordinating care organization, which also provides medical support to underserved population. And they're very interested in several of the nutrition programming that we have done in other strategy areas.
Right, thank you. The next question is a fairly long one, but it's from Maria Rodriguez Alcala. She says, in all my years, I worked with agriculture in the US and abroad. The single biggest barrier I've seen in access to healthy foods is that small farmers from underserved backgrounds cannot make enough money to sustain their families over time. This is not just about access to markets, but more so regarding profits over time so that they remain in business. So my question is, does your program consider this issue for farmers down the road? Basically, my concern is that if we want farmers to be there tomorrow, we need to ensure they are making livable wages. Too many programs overemphasize the consumer/health side and assume just having a market will help the farmer. But farming is a highly risky business overall that a market alone will not do it. So that's the end of the question.
Kelly, you want to answer? You want me to go for it? So as you saw in our opening slides, economic development remains a critical strategy to all of our interventions. We are intentional about who we partner with and how we partner to contract to get funds out. And that certainly goes for the farmers. That is definitely a concern and barrier that we have, something that we are very intentional about as we look to roll out the strategy area, where we contract with Black and African farmers, emerging entrepreneurs to get the dollars that we have to them, right? And I'll say that it sounds like a very simple statement, but then there's also hard and complex in that you have a lot of, individuals who simply just want to grow food, right? But if you're interfacing with Multnomah County, which is a government institution, trying to get federal dollars out, right? There's all these restrictions and rules and contracting policies that we have to abide by, but we do so literally working alongside partners to build their capacity to feel confident to be able to get through the procurement process to be able to do that. So yes, to your question, we certainly have that at our forefront and really are intentional about building farmers and food entrepreneur capacity. And I'll say, in this example too, there's so much going on. We didn't talk too about how, we also partner with farmers to be at farmers market, right? So thinking about those opportunities, we partner to put together an event called Reclaiming Black Joy, where it was going to different parts of the county and literally just celebrating Black joy. And part of that was definitely also having an economic focus, where again, farmers came and brought in produce to their efforts. And, and I was saying lastly, to close out, there's actually, looking at some, so similar to that concept around universal basic income, really looking at it to possibly explore that too with farmers. That's one idea that we've heard and something that we're really interested in exploring, to really just give them that financial support and capital to help them to stand on their feet. And like they always like to say, we just simply want to grow and not be out here applying for grants.
Thank you. The next question comes from Valerie Schneider, who is asking, could you repeat your role / where you work along with some of the process of building these partnerships to start? This is super creative work. I'm trying to think through the partnerships it would take to make interventions like this work in our community.
You can get us started, Mikayla.
Yeah, so Reach has 3 different strategies, which include our nutrition strategy, as well as our community clinical linkage strategy, and then our physical activity in the built environment. So we have a program specialist for each of those that have an African American or Black KSA for the outreach. And I mean, we do it also by working with our Achieve Coalition, finding different programs, finding different farmers. Within Multnomah County, the Black community is very close knit. So a lot of our outreach is through one another or spoken word.
Yeah, and I'll say adding to that, so I think we certainly have, one of the things I'll say, I think that question is leading to, it's so important and critical, is trust. The REACH program through our Achieve Coalition, which have been in existence for 12 years, have longstanding trust with the community. Although we work for county government, people tend to, they see us as, you work for Multnomah County, but you're not Multnomah County because you're also part of the community. And I think that helps us to build trust, to be able to honestly work through some hard and difficult challenges, right? So while we are county government and we have our rules and restrictions, we come alongside really just looking to build community partner capacity, right? We are like that intermediary folks where we're trying to get community to understand and break down the county rules, to help them to be patient, to stay along with us, to take those steps. So for that piece, it certainly looks different. I know for different jurisdictions, depending on your authority or how it's set up, things might operate differently. And I think some of it sometimes is really thinking innovatively. We face mountain of challenges. Of course, we all know COVID occurred, but with the cross property as an example, we just recently were able to even get water to that property. But while we were waiting to work on that, right, there were other things that we were able to do and challenges to work and solve through. So sometimes it's just staying committed in spite of the challenges and just continuously thinking about innovative ways to engage. And I was saying lastly too, like even with the CSA, Mikayla, you want to talk about even like the CSA as an example of how, we started with a set 8 weeks and then have partners who wanted to expand, and how, working with other multiple farmers to make that work.
Yeah, so we start with 10 weeks for our CSA. We were able to serve 2 different CSAs this summer, and one of them, like even with the farmer, that farmer having hard times or hardships, we were able to, adjust and then add more weeks. And then we found out that people, they really want a year-round CSA for real, actual nutrition changes. Sorry, I've been talking too much, but yeah. So we're looking to partner with Care Oregon, as Charlene explained earlier, to actually do a year-round CSA. We're looking to do that. So.
Great, thank you. The next question is about, it's from Barbara Roberts, who asks, why the promotion of organic foods over conventional, AKA safe and sustainable foods?
Organic food is better for the environment, and being from Portland, Oregon, we focus very much on climate friendly and sustainability. And if conventional food is often sprayed with pesticides, which often leaks into our rivers and our lakes. And so we focus more on organic produce as a sustainable produce.
Great, thank you. The next question is from an anonymous attendee who asks, is it correct that Multnomah County was able to implement the 5% preference for BIPOC vendors through a nutrition standards document. Great idea of a policy through which to do that.
So that's a policy we're working to likely get adopted. So we're in the process of it. The intent really was to aim low, but expecting us to go high, right? We're working with a lot of small emerging farmers, and we want to make sure that we're able to get some quick wins that we're able to build on and build upon. Thus far, we have not received any objections, so we're pretty confident that that amount, that percentage will be our starting number.
Thanks. Then the last question that we've got in the Q&A, so it's sort of perfect timing, is from Alice Kungu, who asks, how has the program been received? How many people enrolled?
It's been well received. Actually, I'll start with some of the history and then turn over to you, Mikayla. So when we first started with the first round of the CSA, we started with the Google link. Ours, we had, we needed to start small and then look to scale up. So with the link, we wanted to enroll 50 people before the deadline. Before the end of the day, when the link became live, we had over 150 people had signed up, and we had to close the link. So I think that just sort of speaks to that volume of people wanting. I think it's certainly well received. Part of what we've gained from the evaluation that we've been able to do is that we hear people are excited to see people who look like them growing the food locally. Just knowing your farmer, right? It seems small, but yet it's big. People being able to try out locally grown food that otherwise, they may see it in the grocery store and walk by it. We couple our CSA with these virtual cooking class. Well, we just help to break down the barriers to have communion understand, like, you can eat this and this is how it can be prepared, and make sure that it tastes good. And I'll say too, when we started with, thinking about that one individual, but then through conversation, people are like, when I take it home, I'm not just the only one eating it, it's my entire household, right? So it's sort of like that ripple effect of access to healthy, culturally, locally grown food.
Thank you. So before I hand things back to Chrissy to wrap things up, just wanted to say, since we're kind of running short on time, we'll send out the poll results, which again are, the participation is anonymous, but we'll send out the poll results with the slides in a follow-up email to all of the registrants, and you'll be able to find a recording on our website. So with that, I'll hand it back to you, Chrissy, to finish up.
Thank you. Thanks, Charlene. Thanks, Mikayla. Thank you for sharing your work with us. Thanks to everyone who joined us, and do make sure to sign up for our newsletter and our additional webinars, and have a great afternoon. Thanks.